Though it was initially thought to be a mostly environmentally and socially instigated disease, bulimia nervosa has been receiving a lot of attention lately regarding the possible biological factors for predisposition of the disease. Many of these factors are seen as hereditary traits that come from an imbalance of certain chemicals that are necessary for proper brain function. 3 of the most researched chemicals concerning the development of bulimia nervosa are serotonin, dopamine, and norepinephrine. Today we are going to take a closer look at serotonin. Serotonin is a neurotransmitter that has many functions in the central nervous system. It is a derivative of the essential amino acid tryptophan. Serotonin is produced in the brain and is distributed widely throughout the nervous system. Some of serotonin's functions are to help regulate sleep, memory and learning, temperature regulation, mood, behavior, cardiovascular function, muscle contraction, impulse control, and appetite. In regards to appetite, it is known to suppress food consumption. Recently, a trend in the serotonin levels of post-bulimic patients has been under investigation. In many recovered bulimic patients, there seems to be an imbalance of serotonin levels in comparison to a non-bulimic control. While in the throes of bulimia, patients are known to have skewed levels of serotonin. It would seem logical that after recovery, the chemicals should be close to normal. However, many recovered bulimics still have an imbalance of serotonin levels. Thus, there is much speculation that an imbalance of serotonin might not be a symptom of bulimic behavior, but rather a precursor. If bulimic patients have an imbalance of serotonin, their mood, impulse control, and appetite will not be properly regulated, among other bodily processes. Low levels of serotonin might contribute to impulsiveness, which can lead to overeating. When bulimics binge on carbohydrate-intensive foods, these foods are then broken down into sugar, and the sugar is then converted into tryptophan, the precursor of serotonin. Because the body then has an excessive amount of tryptophan, it will be able to synthesize a large amount of serotonin. The excess serotonin that will be produced will then help to improve the mood of the patient. Thus, the addiction to binge eating may very well be an attempt to subconsciously self-regulate an inherited serotonin imbalance. In addition, one may theorize that after an upsurge of serotonin has been produced in the brain, the bulimic's impulse control is more stabilized, which may cause the bulimic to attempt to regain control after the binge by purging. Though no specific bulimic gene has been found, there is significant evidence suggesting a serotonin deficiency may form a predisposition for bulimia.
Gender differences. Though eating disorders primarily affect women, they do affect men as well. It is estimated that 8 million people in America currently suffer from eating disorders. Of those 8 million, approximately 7 million are female, approximately 1 million are male, rated 1 to 7. Similarly, it is estimated that only 1 in 10 people in America with bulimia are male. For males, it is common to see drastic increases of rates of bulimia among certain subgroups. Males who wrestle, for instance, are 7 times more likely to become bulimic than the average male. Increased rates of bulimia are also seen amongst homosexual males and male athletes in general. Females show increases in rates of bulimia and eating disorders in certain subgroups as well, but also show drastically higher rates in males on average. There are many factors which contribute to the rates of bulimia being higher in females than males, one of which is the drive for thinness, which is essentially the idea that media and other influences have taught women to be dissatisfied with their bodies by purveying an unrealistic image of what the average woman looks like. For example, the average American woman is 5'4" and approximately 140 pounds. The average American model, however, is approximately 5'11" and 117 pounds. It is estimated that by age 13, 53% of females feel dissatisfied with their bodies. By age 17, that number increases to 78%. A study was conducted to determine the role gender played in symptoms experienced by people with eating disorders. The study used a sample of 1,056 students, primarily white, ages 14 to 18. The students were asked a series of questions regarding their eating habits and body image. Traits found to be consistent with females who had suffered an eating disorder were general body dissatisfaction and the previously mentioned drive for thinness. The only trait found to be consistent in males was a habit of excessive exercise. Participants of the study were also asked if they had an overeating episode in the past 3 months. 28% of women and 14% of men reported having done so. The study found that women were more likely than men to associate their overeating with a sense of loss of control. The researchers hypothesized that socialized gender roles designated to women contribute to them being at a greater risk of developing
The leading cause of bulimia and other eating disorders is often social pressures. These come from a variety of sources, including media, peers, and family. It has been studied that over 50% of females ages 18 to 25 would rather be run over a truck than be fat, and 2/3 of those surveyed would rather be mean or stupid than fat. It not only affects young women too, but also older women as well as men. In the media, bulimia has often led to the idea of a good body and the American desire to be thin. It is broadcasted in movies, television, and advertisements as the ideal body type, often associated with beauty and femininity. This leads to our American culture as looking at fitness as the right body type, a healthy one that people should aspire to. Friends and family. Eating is often viewed as a social gathering. Many examples of people who developed an eating disorder often develop them after meeting new people with different eating habits. Social pressures that come from this often are the ability to follow suit or fit in with your new crowd. The pressures from family are often those for their family member to be healthy or desirable and to change their eating habits accordingly. Often, bulimia is developed as a way to gain parental attention as well. And then often, parents deny the fact that their children has an eating problem, which leads to a vicious cycle. The professional world. Many athletes suffer from bulimia. Binging and purging is often used to get many different effects. Sometimes it is used to gain or lose weight fast to get into a specific weight group. Or it's to stay in the ideal body type for a person's specific sport. This also ties back into the media, with fans of sports wanting to emulate their favorite sports players. Social pressures not only lead to people developing eating disorders for physical reasons. Pressures such as work, school, family, and/or friends can lead to self-harm tendencies. Much like risk cutting, bulimia is considered a self-harm practice and is also used as attention-seeking. These behaviors are not only attention-seeking, however, but often used as a buildup and release of tension or anxiety in someone's life. Once discovered, often people are pressured into getting help. This is considered a positive pressure, often from family members or friends. Those forced into medical help often heal as well or even better than those who go in voluntarily, and is often considered a positive thing.